Welcome to another episode of The Disruptors, where we're arming you with the tools you need to innovate within the physical therapy space by highlighting those who have come before you. I'm your host, Stephen Cohen. Now, let's get into it. Welcome back to another episode of The Disruptors, where we're highlighting innovators within the physical therapy industry. Today, I am so glad to have Sara Bryan join us. Sara is a physical therapist and fractional operations executive with her business, Sara Bryan Solutions, established in April. She holds a Master of Physical Therapy from St. Catherine University and began her career at the Institute for Athletic Medicine, focusing on patient and provider well-being. Throughout her career, Sara has excelled both clinically and administratively. At Kindred Home Care, she led the Ortho Home Care program, and at Twin Cities Orthopedics, she contributed to their value-based care department, ensuring optimal patient outcomes. As Director of Operations at Co Technology, she built a team of physical therapists and discovered the Entrepreneurial Operating System, EOS, for business efficiency. She's also served as the Vice President and Interim Executive Director of the APTA of Minnesota, where she improved strategic planning and operations. As a fractional executive, Sara transforms clinics and healthcare companies into efficient entities, focusing on patient care, process improvement, and business growth. Now, let's get into it. So, Sara, I love to ask this question, and we're going to take a step back in time, right? So before you decided to go to St. Catherine University, why did you decide to become a PT? What is your why behind it?
Yeah, and thanks for having me. It's been nice to get to know you, and I appreciate being here. I think all of my classmates had always had these stories. I wasn't much of an athlete in high school. I hadn't had an injury, but from day one, I wanted to do something to help people. I used to play teacher or doctor or my mom said at one point, she goes, I wasn't sure if you were going to go into the convent because I went to Catholic school. Like everything was about helping other people. And I think as I started exploring, we had a friend that owned his own clinic in Waterloo, Iowa, super small town. And my mom said, why don't you shadow? Which I was super thankful for looking back, and spent a day with him in clinic. And it was, I think for me that stood out was the fact that my interactions with doctors were almost more transactional, and I would still say that we have that. And I saw at PT, he had a mixture of new patients and just ones that were coming back and thanking him. And just that interaction really appealed to me. So then as I was continuing to go through my journey of exploring healthcare, it was like, you know what? I think PT is the right place for me. So just seeing all of that. And there was a little bit in starting at St. Ben's. I'm like, well, do I want to do this? Do I want to do business? As you heard from my bio, I did kind of have that or do I do this? And they said, well, it's easier to start as PT and then switch afterwards. So I kind of got on that track. And I think, just how your journey in life goes, both of those passions have kind of, continued with me. And I'm thankful for my career in PT on the front lines at various moments, but I do like the business side too. So that's kind of how I found it. I never experienced PT as a patient, but just really could see the difference in the delivery of healthcare in that setting compared to other things I had experienced.
That's very cool. So you're right. We do hear a lot of like, oh, I had this injury. I was thinking of a guest we had on a few weeks ago, and he had an injury, but also funny enough was also a pastor before he became a PT. So almost like similarly, y'all should meet. I think is the answer on that. And so I love that. So you were drawn in more by the relationship that is the undercurrent or the foundation of physical therapy. Am I, summarizing that correctly?
Yeah, absolutely. I figured, through my career and different tests you take and things that come up, I'm definitely a people person. I get charged by meeting new people, learning their stories, and then I think ultimately trying to help them in whatever way that is. And that just provided a really nice avenue to combine both of that. So I don't think I knew that at the time, but I just, you kind of just keep following your passions and doing the things that you enjoy, and it gets you there.
100%. Right. Your comment on the physician side is like resonates with me really, really well, right? Like you don't have time to tell a doctor how you feel about a potential remedy or whether that be pharmaceutical or not, right? It's like, hey, okay, you're concerned about, I mean, especially today, right? You're concerned about your weight. Okay, perfect. Here's a script for Ozempic. Like, whoa, like,
Yep.
we talk about this, like, nope, 10 minutes is up. Like, I'll see you later.
Yep.
And so versus being in a physical therapy clinic, it's so cool to see just the on the fly adjustments based on the context that the patient lives in, right? And that's why we get excited about serving PTs is they're having to take in. I could get myself in trouble with this one, but they're having to take in more data than many other practitioners, right? It's not a flow chart like, oh, if this, then prescribe this, right? It's much more of a, hey, like you got to know the whole person to be able to find something that sticks, and then you got to sell the hardest thing in the world, which is behavior change.
Yep.
And so you've done behavior change not only at the patient level, but also at the organizational level. So walk me through a little bit of how you got to move from the treatment side into the operation side, and then I definitely have like a part B around similarities and dissimilarities around behavior change at the administrative level.
Sure. Yeah, I was pretty fortunate to have good mentors when I was started at the Institute for Athletic Medicine, and it kind of just worked out opportunity wise. It was a smaller clinic, so pretty young. I became supervisor, I think about 3 years out from PT school, and I kept getting drawn the more I learned about the back end and how it was like, this could be better, and this could be better for the patient, and this could be better for the providers. And just knowing my own level of fatigue and trying to figure everything out, I would just get drawn to that. So then just started doing different programs and activities, raising my hand for things that anytime they wanted a focus group or anybody, I started getting asked for that kind of thing. And it just, I felt like I kept uncovering these little things that in my mind were maybe decisions made in the best intent, right? But really put extra strain or couldn't check the box. And obviously, I was one of the first clinics to go live on Epic. So way back, I didn't have a smartphone until 5 years into my career. So like now with all the apps and we talk about texting and all the things that SaRA does, that was all unknown. So definitely there wasn't the resources, but even just watching how Epic was implemented and how that wasn't designed correctly. They didn't factor in, we need cosigns and we need all of these things. Like there were so many things that sounded great, but really was built in a way that just added more stress to the clinicians, not helping them. And not that it was promoted as helping them, but it was like, you just have to do that. And I think that there's definitely opportunity with all the tech, with AI, with different things, how it's not replacing the provider, but it's really enhancing their workflow. And that just continued to become a passion of mine. And ironically, then I have 3 boys. They're teenagers. My first one's in college. So I was having those children as I was going through my career, and in some ways thought I was taking a step back, like, there's this education program coordinator it was a role held previously by an athletic trainer. They didn't really know what they wanted. And I just needed a break. But yep. I learned a ton of the backside about planning things and how really to work with really surgeons and primary care sports medicine providers, athletic trainers, PTs on planning this content. How fun it was when we could really organize and I could get the details covered, that their creative abilities to come up with speakers and do more. So I really enjoyed that. It was kind of a part-time role while I was having my kids. But I really learned a lot and just continued to see that I love that. And then I think I took after my 3rd son, I'm like, all right, let's try this home care thing. I figured Medicare is something that's, I'll be on it. It's huge. I need to understand it.
I love that.
The supervisory requirements and stuff in clinic. So I ended up working in home care, which was really humbling because you're in the home. I mean, talk about meeting the patient where they're at. It taught me so much. It was one of the hardest jobs I've had, I would say, of just the documentation requirements. And again, that probably tested my limits of what I could take from a process and standpoint of what like didn't make sense, but we had to fill it out, even though you're contradicting yourselves in areas on their billing, paperwork essentially. And then quickly there was an opportunity to start their orthopedic program. So I felt like I kept getting drawn to how do we help people that aren't in healthcare making decisions that affect healthcare, the patients and providers? How do we get ourselves at the table with that experience? And so I started to feel guilty about not treating patients, but then realized, I can hopefully serve them well by being there and being present in those conversations and saying, hey, did we think about this? Have we thought about that? Or wait, let me actually see the tech to see how it's going to work to make sure it does do what you say. So that skepticism side came through.
Oh, there's so much there. There's so much there. So I want to highlight a few things that you said I think are really good takeaways for folks. So one, good mentors. That's been a common thread in pretty much every episode. So we'll lay that. Yes, check. Like got to do that. And we've covered that at length. But one of the things we haven't covered at length, which I do want to spend time talking about, is you mentioned you kept raising your hand. And to me, that says you were willing to take risk with your time. And so, like, how did you go about choosing what to raise your hand for? Or was it just like, hey, I'm going to just raise my hand for everything for right now? Walk me through a little bit if I may be asking you to remember back. I know you've slept since then. But, as you think about that time when you were raising your hands, like what was some of your decision criteria? Like, how did you think about that?
Yeah, I think, initially it was just the topic probably intrigued me. Like I was just drawn to it, or enough where, and my dad was on a lot of boards and did a lot of things. So probably there was some influence there of just knowing he had night meetings or would stay extra to do some things. But innately, I've learned that about myself. I'm just kind of drawn to anything. It always was in the guise of like improvement, right? Like, hey, we want to do this to do that. It wasn't like, hey, do you want to come and sort paper? Now, if it was like to really help a department, I would probably still do it, but it would be more like volunteering versus feeling like I was going to contribute. So I think that initially it was, just that innate, there was some sort of good that could come out of it.
Yep.
I will say I've been in experiences where there was, that probably drives my passion, where we're sitting at the table, this sounds great, all these providers are giving their input, and then it just feels like it was a check the box moment, and we'll take that, write it down, and we're just going to put that over here, and then we're still going to do it like what we thought. Like it was, I think we didn't say what they wanted us to say, so then it turned into this, well, we did a focus group and this is how we decided to roll it out. And it's like, well, that's not really what I heard in the room. So it kind of made my voice stronger to say, just that. And again, nobody's doing, I've had the mentality, especially when we worked at TCO, we had to get into a lot of hard conversations. Nobody wakes up and says like, I want to be mean, or I want to ruin healthcare, or I want to make providers' lives hard. Like even the insurance company, I don't believe that they think that. I just think people are just naive and they get more focused and narrow focused on what they ultimately need to accomplish versus maybe rethinking what that end goal looks like and how it affects people.
100%, and I really, I appreciate that. And the takeaway, I guess, for point number one is you let your passion drive where you raise your hand for, and I think that's a really smart way to look at it, because it's going to be extra time, it's going to be extra pain, right? There's going to be some extra discomfort along with that. So unless you have passion to buoy those more darker days or minutes or whatever the time period may be, letting your passion drive that, I think that's really important. And you talked about being at the table, and I want to also prior you said You just have to do that. And I think that phrase and that mentality worked until COVID-ish,
Yeah.
right? That worked. And now, I mean, and this is lived experience on my side, right? It's outside of a very select few practice owners that we work with and leaders, like they're that mentality is all but gone the way of the dodo bird. And I think that's good, right? Because as a tech company in the healthcare space, or health tech company, however you want to describe us, we know that it can't just be like the owner or practice leader or whoever is just like, you guys got to do this. That doesn't fly anymore, which I think is actually great. It holds us to a higher standard. We cannot check the box, not that we would want to anyway, but it holds everyone to the standard, the high standard that you have for patient care, right? Like we should have almost like provider care, right, on our side, and try to come at it with the same fervor that clinicians do. I really really like the passion driving where you raise your hand. I think that's really
Well,
important.
and I would just say too, like I think what I also learned is really, they always say that be a good listener, because it is worth understanding why some, administration is coming down and saying you need to do this. I mean, it's insurance companies are paying their bills, regulations are setting the standards of what counts. So I think it's recognizing even as providers, and I've had lots of conversations, especially when I was at the APTA for a year and a half, of people calling in that frustration. And so I do think it's helpful to understand what the constraints are on the business, but wanting to come with like a solution of how do we work together to make this happen. And I would agree. I think that there's more willingness to be more innovative and figure out how do we do this, and just having that litmus test of, if you're creating more burden on somebody, either side, whatever department, there's usually going to be anything new, usually creates something somewhere.
Yep.
How do you minimize that and then show the value behind why it's necessary? Because I think there's just plenty of things that people just were worried about, and then fight back at the things that are maybe impacting your business or going to impact morale. I know hiring's tough these days, like keeping staff, retention, the preventing burnout, all those things. There's not a perfect answer, but I just think that willingness to engage in that type of philosophy and conversation is helpful for both sides or all sides.
100%, 100%. There's a chapter in Jocko Willink's Dichotomy of Leadership that actually talks about just that, right? Of, hey, do your best and make it your job to align like interest across the continuum, right? Like, oh, like, okay, I'm a staff PT, right? Like, I'm being asked to do this thing. Like, why is the clinic director asking me to do this thing? And just even understanding that, like, either A, you're going to build more empathy for like why it has to happen, or B, what is probably more likely to occur is like, okay, I understand we have to do this thing because of this influence. Like, could we tweak it a little bit, right? Because I think you're right that there is no perfect answer. But I'll add to that, there's no perfect answer broadly, but there are likely perfect answers in microcosms, and that's where your advice to be a good listener and learn the why, I think is really salient, especially at this point in time. So we're up to two. Totally. Typically I get to three, so Sarah, you're way ahead of schedule. And because you are, we'll take a little bit of a detour. You and I have had this conversation. There's all sorts of fractional opportunities for clinicians out there. I think of like Luna for physical therapy, right? For practitioners that want to get a couple extra hours here and there, and almost work like fractionally as a PT in a different environment. But it doesn't have to be in delivering care, right? And so I'd love for you to talk about your journey into a fractional executive with your PT background.
Sure. Yeah, I think over the last year and a half, I did have the opportunity, kind of my interim role. I was on the board, and then we had some operational changes, and I was in a position to take on and do that. So it was kind of my first thought of, it was more full time, that interim role where it's not where you're signing up for as long as until it's not, like where most jobs you're going for it. So, and then looking at like, the consultant versus, sorry, my hair, consulting versus fractional. And then, kind of over the last year, I've been networking more outside of healthcare, just kind of more curious on through network connections, other healthcare providers, but also marketing and HR and learning that world a little bit to just see how people functioned. Partly some of COVID, those were the events that started back that friends invited me to. And just learning that I think fractional as a whole is becoming a bigger thing and becoming more real, that there's a huge movement. And what I see that was kind of encouraging, or where I thought was opportunity, is in a lot of these either private practices of PT or the health tech company I was a part of was so small. I mean, even at a couple million in revenue, you don't always have all the resources you want. So how do you bring expertise and just get what you need, kind of that efficient and streamlined services to be able to provide that? And I think I'm seeing a lot of opportunities more in the healthcare space, where they want providers, and some of that's fractional, some of it's not. But I think that there's a huge opportunity to help progress healthcare and create innovation by hiring people at a fraction of the cost and the time, but it's still effective in what's needed. Not everything needs to become a full-time job. And I'm fortunate to be in some place in my life where I can do that. There's always insurance and all these other things, but I definitely think that there's enough ways around it. And I'm learning more and more from that community that there's a lot of success and people are very energized and they feel dedicated, but maybe it's just to a few different companies. And they deliver high value, and they're able to, have satisfaction and meet all the needs of their families. So I'm excited to start that.
And, I mean, I'm a very big proponent of it, because we've done that with even with our chief clinical officer, who, at first we just could we have found work for him to do? Sure. Right. You can always find work to do. There's, the Parkinson's law is just a great one to look up for those listening, if you haven't. It's why somehow meetings that are 30 minutes always end up lasting 30 minutes. Like it just ends up getting filled somehow. Yeah. That's Parkinson's law. And so, I think there's two things that you're pointing out as strengths of a fractional role. One, selfishly, you're only going to get the highest value work, right? So you're going to get to do the stuff that you probably enjoy the most, like the highest value work to be able to do, which is fantastic. And then, more at a holistic level, right? By giving a way to be able to interact with these companies in a way that they can afford, right? Then you get the seat at the table too, right? Like it's really a nice, like, two birds, one stone. Thank you for listening to this episode. This would not be possible without the sponsorship of SaRA Health. SaRA is the relationship operating system for physical therapy practices, driving better patient outcomes, improved arrival rate, and improved financial margins. If you'd like to learn more, check them out at SaRA, SaRA Health.com, SaRAHealth.com. And if you'd be interested in advertising with us and helping us produce even more great stories, please let us know at Steven@SaRAHealth.com. Now, back to the episode.
I'm also drawn to the tech company was founded by a nurse. Knowing the PT practices, a lot of my colleagues have moved on and owning their practices. You don't get trained in business side of it. And so you need to, have that support. Yep. And I just have found that I do have that skill set of improving things, making things more efficient, going and launching programs, starting things that if I can help do that isn't a natural ability for a lot of PTs. It does a lot of the work. Project management follows kind of how we do an evaluation. So that's how I'll talk about it. But again, having that time and the energy and that that drive. If things are your natural passion, it takes less energy to do if you're forcing yourself to do things that aren't your passion. So
Yep.
trying to help those entrepreneurs in the healthcare space, take that stuff that's not driving their passions off their plate, and doing that, and hopefully by a fractional way is a way to do that. I'm not opposed to helping people on a short-term basis, kind of like I did with a chapter, but I mean, I just don't, I think that the world is changing where that's just becoming more real, like really focus on outcomes, really focus on what are the deliverables that you need. And that's what you're paying for. It keeps companies more nimble. When we talked about the hospitals versus when I was at TCO, they were more nimble. That's how they could stay in the market versus in other states where a lot of surgeons were being bought up and employed by hospitals. Those surgeons, that always stayed with me, that if you can stay nimble in the market then you're able to, keep your private practice, keep whatever business you have going, and not have to give it away if that's what's being the end result. So
Absolutely. And you mentioned that you looked outside of healthcare as well. I know that when I talk to some of my fellow founder friends and that aren't in healthcare, if anyone ever asks, like, oh man, like who do you think would be good for like a customer success role, or someone like that, I'm like PT, 100%, like without a doubt. Some of the strongest, empathy, some of the strongest research, like especially personal research skills, behavior change, right? Like all the things that are going to be that you, if you're going to like think of like the A player, right? You're going to like, oh, I want these 5 things that I just listed off. Like, oh, well, PTs like have all of those in spades, like coming out of it. So yeah. How was your journey outside of healthcare?
Yeah, it was interesting. It was a COVID related change, but and I'm always an early adopter with tech. Like, yep, our clinic can go first with Epic. Let's build this care management software. I'll be the point person. Like I do like tech. So it kind of happened to be this good role that really matched from what was coming off of the bundled care that I was doing at TCO. And it was so it was an easy transition in that way. But it was different. I'm downtown, at a WeWork, sitting, with all these other entrepreneurs. So it was kind of a culture shock in that realm. And then kind of discovering that the team that was hired to be kind of their client success managers, it was an outcomes company. So we changed the name. So because most of the people that were talking to were some were clinicians, some IT, but outcomes managers ended up hiring 4 or 5 PTs. And that really went over well with our clients. Were mostly academic hospital systems throughout the United States. And so being able to talk data and going into that role, it was rewarding for me. I had clients as well. And then kind of one by one, switching out the team into these therapists. And it was a little bit post-COVID burnout, I would say. And I'm always very thankful for all of our practitioner and the providers and PTs and nurses, all the staff that are just day in and day out can do it. But I think if you need a change for just a part of your life or a different direction, to use those skills there's so many jobs that does overlay. Like you said, there is a lot of value into the skill set we've established by being a physical therapist, doing assessments, looking at goals and outcomes, and following through and all the people piece of it too. That's super beneficial in the business world. So I've seen a lot of transition. I've seen a lot on LinkedIn of client success and other companies that PTs are moving into. So as much as I don't want to see people leave the profession, I don't really see it as leaving, but like broadening. Like nurses, there's a lot of nursing roles that it's not really thought of second nature, but now I see PTs going into that realm, and I definitely think it's appropriate. So
is that the future for your company? Is you're going to be like the Luna, but for fractional executives for
a good idea. I'll consider that on my next personal business planning session. So and
I just want brainstorming credit. That's it. I just want brainstorming credit. That's all. Ideas don't matter, execution does. So nothing more than just a footnote would be plenty.
Yeah, that sounds good. I promise that will happen if that happens. So, yeah. No, I think it was a good experience. I ended up only leaving because, which, thinking about my life, which I was scared to do was to not be a PT. Like you go to school, you have this degree and a lot of times student loans that go with it, especially now. And to feel like you're giving up on it, that was an interesting thing to go through, that I felt like, even though I'm in the healthcare realm, I'm not a PT. How does that? And that was the same with my team. We'd have some of those conversations of what does that mean, and just reevaluating your value that you're bringing, and how I couldn't have had any of the roles that I've had without being a PT first. So going there, that was hard. And then we had a family friend very close to my kids and us. Their son died of sudden cardiac arrest. About 6 months prior to my dad's health was also declining, and working with a coach, another thing I'd recommend if people, I've had a coach actually started at TCO. They invested in our team, and then I hired her independently. But really helped me see that, it's okay to step back, and, really looking at our finances to say, okay, really, if you really need to step away, what can you do? And I literally didn't think it was possible. And we ended up, we lived off even less than I thought we could have in the time without really being the big, it just sounds scary, really. I think it's more fear-based. But that's what I was going to take about 6 months off, kind of start the consulting, figuring it out, and then had the opportunity to go work for the chapter. That was kind of an in-between thing. But I think it is, as I'm getting older now, learning that, just finding places to provide value, or that's what charges me, which I think that's most people. You want to do something worthwhile and be important to something, or have something as your meaning, whether it's in a job or your family or whatnot, that it's okay. Like if you sign up to work with a company, it's not, especially since COVID, it's not this like, oh, they expect you to work there for 10 to 20 years. There's going to be cycles, and it's okay if your life changes, or that you need to do something different, or it's not a good fit. That's, I think, the other thing is just learning that, having people help them find opportunities where they better align. So it is better, even if you have some like issues with personnel, it's two-sided. You want to help other people find where they can be, beneficial and find joy and have value in their work. Being miserable in a job doesn't help either party. So, I've kind of learned I'm just going to roll with this. It's where I need to be right now. And I'm okay with the unknown, which is, it's not every day, right? I still have days and people are me. There's ups and downs. Like you probably, as an entrepreneur, like there's, what did I do? And it's that, and I was warned by that by my coach too. It's always that, did I make the right decision? But at the end of the day, I realized there's a lot to give, and there's a lot of options out there.
A ton. There's, I was reconnected with Tanis. He's now at Net Health. His company got bought by Net Health, and their motto was wait 5 minutes. And like more or less, nothing is as good or as bad as it seems in the moment. And I think that's really good advice, and I like his framing of it too, of just wait 5 minutes. And, when you talk about that, almost that like identity struggle, right? As a provider that might not be providing direct patient care. I know my wife's a nurse practitioner, and she was an RN on the floor, became a nurse practitioner, and struggles with that because there's some things that she really likes, in the aesthetics world and elsewhere that. But she has that, like when you start talking about like when I have student loans, like, oh my gosh, like it's like the same dissonance, right? That can be so tough to overcome. And, I don't have lived experience on that side. I just see it vicariously. And when just hearing you talk about it, the similarities are just wildly wildly similar. And
Mm-hmm.
so it sounds like that career change was something that you're incredibly proud of on the career and PT side,
Mm-hmm.
right? What about personally? Like, what would you consider your big accomplishment on the personal side?
Yeah, and I think one of the other traits I inherited from my dad is that like work that I would put a lot of time into work, all like, and not afraid to do that, and sometimes at the sacrifice of um my family. And in the last, especially since COVID changed, our friends lost their son, all those things put things into perspective. And really what has been fun, my oldest is 19. He's going to the University of Iowa studying engineering. And now kind of having that relationship with him. And then I have a 16 and a 13-year-old, um, watching them as adults and just seeing like that interaction and having them, how we talk and how we spend time, and they still want to hang out, and or for me refocusing, and still being able to work hard and then be available, and just really refocusing that for myself, kind of work related, but it was kind of that self-care thing I'll talk about, is really how to refocus my priorities where I really wasn't losing out on the work side like I thought I was, and then setting boundaries. Like, so I really, everything we do, I should say, is for like, I think about my family and my kids and just watching how they've turned into these amazing teenagers and adults and how they process things and have jobs, and they're so different, but yet they're all on their own path. I'm just really excited to see where they go.
That's so cool. I'm a couple decades behind, or not a couple decades, a little bit behind you. We got 1 2-year-old I'm in our co-working space today.
Yes. Like it.
It's kind of like a WeWork, maybe a WePlay.
Yeah, I like it.
I like it being in here because especially when he gets home from daycare, like it's a it's a stop. Like it's not happening until after bedtime, which is something I it's a design into it. That's yeah, I completely agree with you. And where where I start to think of too, I'd be curious your thoughts on this is you're taking risk and you're modeling that for your kids, right? For your boys.
Mhm.
And I think about that a lot of, technically or not technically, like this is by no means as safe as just staying at Deloitte Consulting, right? There was like a very
Mhm.
obvious path up, and yes, you had to perform, but like there were guardrails around being able to do that. There's no guardrails in entrepreneurship, right? Like you can
Mhm.
do as much financial damage and personal damage as you want to. Like people are more than happy to, give you the rope and tie the new. Like they're,
Yeah.
they'll let you go out there as long as you want to. You'd be curious, like did your boys have any impact into even some of the risks that you've taken to be able to be that model for them and show like, hey, this is possible?
Yeah, I think my youngest is our most outgoing, energetic kid. I shouldn't. The other two are kind of like the firstborn, the middle, and he's like that youngest. That's energy, and he's always been willing to just do whatever, get up in front of people, and I can be extroverted, but I lean more introverted. So some of those chances, like he doesn't have a fear, and he's been that way since he was, crawling, and how he would just independent and just all the little things he would do and how he interacted with people. Um, so I would kind of tell myself, well, I am his parent, with my husband is more a little bit on the conservative side with me, that it's okay, somehow, that must be inside of us at some point. So I just need to channel will and and put myself out there. And it was fun, my just in creating my website and even SaRA Bryan Solutions versus SaRA Bryan Consulting. Ben, my oldest, was like, "Oh, I like solutions," because the iteration and just having them weigh in, it was kind of fun for them to say like, "Oh, you're going to start that, and that's cool. That's great job, mom," and um, things like that. So it's nice to have that where I didn't. They would always say like, "No, what do you do? Like you're a PT." They would just say I was a PT, and I'm like, "Yeah, I'm a PT that works in the office too." So they just didn't really know what I did. So it is, even though they don't really know what I'm doing, they can conceptualize around the fact that I'm running my own business, and it is kind of nice that they kind of put me on a pedestal for that. Which, yeah, I'm like, well, my paycheck. You have your days where it's like you get to build the business and do all that, but it's been nice to talk through that with them, and hope I could see them going down that track too, potentially as entrepreneurs, at least a couple of them. So if I'm inspiring, that's great. Time will tell, I guess.
From a lived experience on my side, I don't know if I would have started, especially my first business, if it wasn't for my dad having been an entrepreneur and just knowing that that's possible, right? Like opening my
Yeah.
aperture to, and I'm in Kansas City, right? You're in Minnesota. We're not exactly known for the tech hubs, right? Now Minnesota, granted, Minneapolis, like, yeah, growing, but anyway, it's not the Bay Area where we get to see that all the time growing up. And so, just even knowing that like I could be that person by only feeling 1 degree of separation away, I don't know what that will unlock, but I think it's probably not bad, right? So I really look forward to seeing how that flourishes and the ripple effect of what you've done, both within your own family and outside of it. And as we get to wrapping up here,
Yeah.
I do have my favorite question I get to ask, which is, if you had a magic wand and you could fix one thing within physical therapy, what would it be? And it can't be more magic wands. We've just been asked, but what would it be?
Yeah. There's a lot, right? But I think in coming back to physical therapy, a key, especially with some recent involvement in hearing from payers or different the models and how things work. I think really continuing to hear how the MSK, the musculoskeletal spend, um, is really a burden for insurance companies, but it's where their highest spend is. And just like then there's those people and seeing, I had insurance companies say, you're big in Minnesota, we have 90-day direct access. So it's not full unrestricted direct access. We still keep fighting, but legislature, especially these days, is so interesting and difficult to change that. That really has nothing to do with the literature or evidence about around it. So like when insurance companies are saying the thing holding you back is direct access. So I think just full direct access for all PTs across states, I think would really do a lot to improve the whole system, and having insurers, patients, everyone recognize the value of movement and PT, and just how when we're looking at all these chronic diseases, again, liking to go big picture, I think it's such a vital thing. Everyone's like, oh, it's like still treats us as a modality at times, like, oh, go get PT. You don't go get cardiology. You get it. It's a whole thing. It's, oh, I did PT, check. And I think just that if my hopeful, especially when I watch these younger students coming up that are passionate about it and seeing that excitement, getting doctorates now, the money going into it, it's like there is that value there, but it's not being realized. And I think that whatever all those barriers are, those could just go away. The tangible one is direct access for everybody, but
that rings just loud and clear. Part of what we have seen within SaRA is, especially for someone post discharge, messaging back and like basically like, hey, I had something else flare up. Can I come back in and see you? Now, granted, for Kansas and Missouri, the direct access isn't that bad. So, like, I think Kansas is actually really darn good. But they're able to get in and do that, right? And it goes back to your point on like you don't get PT, like that person didn't get a commodity called physical therapy, right? They have a physical therapist, and they do understand the value, and boom, like they're right back, and doing that as the first line of defense instead of PCP, NSAIDs, like potentially an MRI, extra, like all the things. And not that there isn't the place and time for those, but for non-specific low back pain, MRI is probably shouldn't be the first thing, or somewhere in the top three, right? So I completely agree with you on there, and where I would love to see the industry be able to go is be able to just quantify and document that value that's delivered, because I think that is woefully mistaken today, right? And there's two pieces of that. Like, I think one is you're having to fight against the natural human tendency to reward the firefighter, not the person who puts in the fire alarm. And so because it is preventative in nature, it's so hard, right? Like, hey, this PT had an amazing episode and relationship with this patient, which then resulted in this patient losing 20 pounds because they decided to get into exercise. Like, well, what is the other, like, what you kind of got to guess, right? And there's not even follow up, like, to be able to know that. So I think it's both a data obstacle as well as a like just a human nature obstacle, right? But that doesn't mean people like you and I shouldn't try.
Right. And you have to start somewhere. That was the biggest. I had a lot of rewarding experiences for the 2 or so years that doing value-based care, managing bundles. I worked with patients pre-op, post-op. It was around total knees. And I was a care manager with nurses. So we had a couple PTs and a couple nurses. And going on that journey, pre-op to post-op, was so enlightening. And I mean, that could probably be a whole other podcast. We talk about the healthcare system of just like the other things, the social determinants of health and all that is now finally, like, you're starting to see that more in mainstream discussions. But the hard part was they were ending it. Luckily, it was kind of ended at COVID, so we didn't leave anybody in the dust, but we had just ended the program the week before. So like their bundle was just ending. That's why I'm thankful for that, that everybody was through, but we saved money. So guess what? Then they keep lowering the bar. It's like, you're not really rewarded for delivering better care, saving money by getting patients home sooner, preventing ER visits, doing those low value add, high cost things. Okay, now we're going to drop it. So now it's not tangible. So it's like, there's something there in the system, but it's not there. So like picking away at it in the pieces. And that's kind of where I had to go. Like, do I even leave healthcare? Am I so frustrated? Or do I get back in, and where can I make some tangible improvements that then hopefully eventually builds? And even back when we were doing that work, Justina Lehman, who is the nurse practitioner that ran the program, she just said, unfortunately, the work that we're doing, we probably won't see the actual results in our lifetime. And you have to just go with it, and you do it for your kids, and you do it for their kids, and we got to get somewhere. So it's just trying to find the tangible pieces you can make effective change, collect data, bring it, raise your hand, get up, get it to the right people, and get it seen. That's probably, where we're at right now.
I would have to agree. Well, in closing, I'm going to take the two of these really, really good points that you've brought up, which is one, like, your passion drives, where you raise your hand, and two, to be a good listener and learn the why of things as they come down, because that's ultimately, like, both of those are, I think, making it full circle is how you get the seat at the table. And getting the seat at the table means you can actually change what's coming down to all of your peers and patients that you all treat. So I think those are two fantastic pieces of advice. There was more in there than just that, but those are the two that I'm going to highlight. Sara, where can people find you? Of course, we'll have it in the show notes and everything, but where can people find you to learn more about you and potentially work with you?
Yeah, and I'm on LinkedIn, Sara, LinkedIn, Sara Bryan, and then SaRA Bryan Solutions.com. So And definitely, if you're looking to connect with other like-minded people, like LinkedIn, there's a lot of groups, and that's been really helpful when I've learned from my networking marketing people. So please, if anybody here is listening, I'm happy to link in and connect with people either way.
Perfect. And with that, I want to thank you so much for joining us on this episode of The Disruptors. So thank you, everybody. Have a great rest of your day. Thank you for listening to another episode of The Disruptors. I hope that you were able to take one or two things away that you can apply immediately to your own innovation journey. As always, I'm your host, Stephen Cohen. This is sponsored by SaRA Health. Let's keep moving.